I badged into the plant at 6:15 in the morning on Tuesday, October 15th, 2024. The Akron air was crisp, and the parking lot was mostly empty, save for the night shift supervisor's truck and a brand new silver sedan that I had never seen before. I had been making this same walk for 18 years, since March of 2006, when I first started as a Level 3 maintenance technician. Back then, my base salary was $48,000 a year. Over the years, through hard work and steady raises, that had grown to $82,000, and with overtime, I usually cleared about $95,000. I did not have a fancy corner office or an impressive title, just a metal desk in the maintenance workshop. But I knew every bolt, wire, and programming line in the entire facility. My background was in the Navy. I spent 4 years stationed at Port Hueneme, working on heavy construction equipment, from bulldozers to massive diesel generators. In the service, they teach you to look at systems, not just individual parts. The chief technician used to tell us that if you do not understand the whole machine, you are just guessing when something goes wrong. That lesson stayed with me. When I joined Apex Medical Manufacturing, I applied that exact mindset. If there was a problem, I did not just patch it. I figured out why it happened and built a process to make sure it never happened again. Over 18 years, I had absorbed a massive amount of responsibility. The company did not ask me to do most of it, and it certainly was not in my official job description. My official job description, which had not been updated since 2006, simply stated that I was responsible for scheduled equipment maintenance, safety compliance documentation, and general technical support. But the reality of my daily routine was completely different. For instance, in 2012, I built our entire predictive maintenance system from scratch. Before that, our maintenance was entirely reactive. We waited for a machine to break down, and that cost us about $200,000 a year in lost production and emergency repairs. I designed a system using thermal imaging, vibration sensors, and regular oil analysis. I wrote the custom code to link the sensors to a central dashboard. We went from 47 unplanned shutdowns per year to just 8. That system alone saved the company at least $180,000 annually. Then there was the FDA compliance tracking. We manufacture Class 2 medical devices, and that means our documentation must be absolutely flawless. We used to have a terrible patchwork system in which the different departments kept separate paper records. In 2015, I built a unified digital tracking system that connected our German CNC machines, our robotic arms, and the quality testing stations. Our preparation time for FDA inspections dropped from 3 weeks to just 4 days. I also became the sole contact point for our key equipment vendors. Whether it was Haas for our CNC machines, Vanguard for our precision laser cutters, or Siemens for the programmable logic controllers, the field engineers had my personal cell phone number, and I had theirs. When a Haas representative retired, he personally introduced me to his successor to ensure we kept our direct line of communication. In 2021, I negotiated a maintenance bundle with Vanguard that saved us $85,000 over 3 years. I did all of this on my own initiative, usually during my lunch break, because I cared about the plant. My old boss, the plant manager Gerald Hodges, understood my value. He was a veteran who had been with the company since 1987, starting on the manufacturing floor and working his way up. Whenever I did something extra, Gerald would pull me aside and thank me. In my annual reviews, he always wrote that I was the backbone of the entire operation. But Gerald retired in August of 2024. The new management decided to hire a consulting firm to optimize our operations. That was how we ended up with Julian Reynolds. Julian was 29 years old, 19 years younger than me, and fresh out of a prestigious Master of Business Administration program. He wore expensive navy blazers and talked constantly about operational efficiency, role clarity, and lean manufacturing. In his very first meeting with the staff, he stood at the whiteboard and told us that everyone needed to stay strictly in their designated lane. He claimed that was the only way to scale the business. I tried to talk to him once. I explained that in a medical device plant, you cannot just draw clean lines on an organizational chart, because the machinery does not work that way. The CNC machines talk to the robotic loaders, which feed the laser cutters, which link to the quality control sensors. It is all one interconnected loop. If you do not understand the whole loop, you cannot optimize any part of it. Julian just smiled, nodded politely, and said something about cross-functional dependencies and process documentation. I could tell he thought I was just an old technician trying to protect my territory. So, when I opened my computer at 6:20 in the morning on October 15th and saw a calendar invite for an optimization meeting at 7:45 in the morning with Julian and Diana Briggs from Human Resources, my chest tightened slightly. I knew what was coming. I walked down to the meeting room on the second floor, took a seat, and waited to see exactly how they planned to optimize me. I sat there in silence as Julian opened his leather folder and began to speak. The conference room was quiet as I took my seat across from Julian and Diana. The glass walls of the room showed the busy hallway outside. But inside, the air was heavy. Julian adjusted his navy blazer, gave me a polite, rehearsed smile, and slid a manila folder toward me. Diana opened her laptop and nodded at me, her expression professional and blank. I opened the folder and saw the printout of my official job description. It was the exact same document I had signed in March of 2006 when I first joined Apex Medical Manufacturing. Julian leaned forward, resting his elbows on the polished wood table. He explained that as part of their comprehensive role audit, they were looking at how tasks were distributed across the plant. He told me that I was a highly valued employee, but they had noticed I was handling many tasks that were outside my official scope. He specifically mentioned the predictive maintenance program, the FDA compliance database, and the relationships with our machinery vendors. He said that these systems and responsibilities really belong to engineering or should roll up to management. He spoke with the absolute certainty of someone who had never actually seen a machine break down in the middle of a high-priority production run. He then announced that starting next month, a new systems engineer named Liam Brooks would be joining the company. Liam would take over the predictive maintenance and compliance databases, while Julian would handle the vendor relationships directly. He wanted me to spend the next 4 weeks transitioning everything to them. He told me that, going forward, I needed to focus only on my core duties, which were scheduled maintenance, safety compliance documentation, and general support. He smiled again and told me to stick strictly to my job description. Julian explained that this would allow the company to eliminate redundancies and streamline the technical workflow. Diana spoke up to reassure me. She said that this was not a demotion or a punishment. My title would remain the same, and my salary of $82,000 would not be cut. They were simply trying to realign resources to improve efficiency. I looked at the old paper in front of me, then at Julian's confident face. I felt a deep, strange calm wash over me. In the Navy, when a generator blew, you did not panic. You just looked at the dials and figured out your options. I realized they had no idea what they were actually asking me to do. They viewed my systems as simple administrative tasks that anyone with a degree could manage, completely ignoring the years of custom coding and fine-tuning I had put into them. I looked Julian in the eyes and told him that if he wanted me to stick to my job description, I would do exactly that. Diana looked relieved, and Julian nodded with satisfaction. He said that was great and that we would set up a formal transition plan soon. He began listing dates and transition milestones, writing them down in his expensive leather notebook. I listened politely, agreeing to every request, but I did not volunteer any information about the custom scripts, the specialized database queries, or the direct engineer contacts that kept the plant running. I picked up my thermos, stood up, and walked back to the maintenance shop. They thought they had just streamlined operations, but they did not know about the document sitting in the bottom of my heavy steel toolbox. 6 years earlier, in 2018, I had built the predictive maintenance system and automated the compliance database. The plant was going through a massive expansion, and my systems kept our lines running when everything else was failing. Gerald Hodges, who was the plant manager then, knew how dependent the factory was on my custom code and vendor contacts. He went to the Vance family, who owned the company, and explained that they needed to protect this intellectual property. Gerald knew that new managers often did not understand the value of experienced staff, and he wanted to make sure I was protected. The Vance family agreed to sign a key person technical agreement. It was drafted as a side letter to my union contract, signed by me, Gerald and Eleanor Vance, who represented the family owners. The agreement stated that because I developed these predictive algorithms, database systems, and custom machinery interfaces outside my standard job duties, I retained the intellectual property rights to them. The company had a non-exclusive license to use them, but any transfer of ownership or modification required my express written consent. If I did not consent, they had to either negotiate fair compensation with me or stop using the systems completely. Gerald had filed the agreement in the shop, steward's grievance archives, rather than my standard personnel file, to keep it safe from future management changes. On his last day before retirement, Gerald had pulled me aside and handed me my copy. He told me to keep it safe because companies often forgot that people were the ones who kept the machines running. I had placed the document in my toolbox and had not thought about it until Julian told me to stay in my lane. When I got back to my desk, I opened my computer. I did not write any angry emails or make any complaints. I simply did what the efficiency consultant asked. I stopped checking the predictive maintenance sensors. I stopped updating the FDA compliance database. I stopped answering calls from our vendor engineers at Haas and Vanguard. I focused only on general maintenance and safety paperwork. I sat back and waited for the natural consequences of Julian's optimization to begin. It did not take long for the cracks to show in the operations. When you stop doing predictive maintenance, the plant does not fall apart on the first afternoon. The machines are built with safety margins, and they can run past their scheduled service windows for a little while. But eventually, the wear and tear accumulates, and when things fail, they fail at the most inconvenient times. For me, the first test came on Friday, October 18th at 10:23 in the morning. Mateo Silva, one of our line supervisors, came walking quickly over to my desk in the workshop. Mateo was a good guy who had been at the plant for a dozen years, working his way up from an assembly line operator. He looked worried, wiping sweat from his forehead. He told me that the Haas CNC machine on line 3 was throwing a high temperature warning on the spindle bearing. In the past, I would have immediately opened my custom predictive maintenance software, checked the vibration patterns of that spindle over the last 30 days, and compared it to our oil analysis logs. Within 15 minutes, I would have known if we had a failing bearing or just a dirty cooling line, and I could have scheduled a quick fix during the shift change. Instead, I looked at Mateo and told him that since the predictive systems were no longer part of my duties, I would have to handle this according to the standard manual. I walked over to the machine, read the error code, and called the Haas customer support line. The support agent listened to the symptoms and gave the standard corporate response. They advised us to shut down the machine immediately to prevent a catastrophic spindle crash and said they could send a field engineer to diagnose it by next Tuesday. They had no technicians available in our area before then. I thanked the agent, hung up, and filled out a formal maintenance work order to shut down line 3. Mateo looked at me in disbelief. He told me that line 3 was scheduled to run the Oak Ridge medical order, which was worth $180,000 in parts. He argued that we could not afford to keep the line idle for 4 days. The line operators were already standing around, talking about the shutdown. I explained to him that without access to the predictive data, which Julian now owned, I could not guarantee the machine was safe to run, and the manufacturer recommended a shutdown. Mateo hurried to Julian's office to complain. A few minutes later, my desk phone rang. It was Julian, his voice sounding much less confident than it had during our meeting. He asked me what was going on with line 3 and why I was shutting it down. I explained the situation and the manufacturer's warning. Julian asked if I could just run my vibration analysis tool this one time to see if we could keep the line running. I told him that the tool was part of the predictive system that fell outside my job description. I added that if he wanted me to work outside my scope, I would need written authorization, and we would have to schedule a meeting with Diana in Human Resources and my union steward to adjust my pay. Julian sighed, told me to forget it, and hung up. Line 3 stayed completely dark until the Haas engineer arrived on Tuesday. The Oak Ridge order was delayed by a full week, which caused a huge bottleneck in the shipping department. The client was furious, sending several emails to our executive board about the delay. The next issue arose on Monday, October 21st. The Vanguard Precision Laser Cutter, which cuts the delicate plastic housings for our medical monitors, began to show signs of beam degradation. The cuts were rough and the machine was throwing power fluctuation warnings. Under my old routine, I would have recalibrated the power supply modules to compensate for the aging laser tube, which took about 20 minutes and cost nothing. Instead, I called the Vanguard service department. They told me they could send a technician on Thursday, and that the diagnostic visit would cost us $3,500 and the cost of any replacement parts. I wrote up the service request and forwarded it to Julian for approval, since vendor management now rolled up to him. Julian, who did not understand the difference between a power supply calibration and a total laser tube replacement, let the request sit on his desk for a full day before signing it. The laser cutter was offline for 3 days. Because of that delay, we missed our delivery window for $95,000 worth of custom housings. After that, the 3 different medical device clients called to speak with our sales office to complain about their delayed shipments, including a children's hospital that needed the parts for their surgical machines. On Wednesday, the operations VP, Valerie Gomez, sent to me a very urgent email about the growing delays. I replied politely, stating that these issues involved systems and vendor relationships that had been reassigned. I suggested she contact Julian directly to resolve the technical and administrative holdups. I kept my head down, performed my basic maintenance tasks, and watched the backlog grow. The atmosphere in the plant was becoming increasingly tense as workers realized that management's new policies were causing the breakdowns. The biggest storm was brewing in our compliance department. Because we manufactured Class 2 medical devices, we were subject to strict regulatory oversight. The digital database I had built in 2015 was the only thing keeping our manufacturing records synchronized with the quality control logs. Every 30 days, the system required an administrator to manually validate the compliance records to ensure there were no discrepancies. If the validation was not completed within the 30-day window, the system was programmed to automatically flag the plant as non-compliant to prevent any uncertified medical products from being distributed. Violation was a simple process for me. It took about 15 minutes because I knew exactly where to look for discrepancies between the German CNC machines and the quality control software. But it was not in my official job description. On Wednesday, October 23rd, the compliance database flashed a bright red alert, warning that the 30-day deadline was approaching. I generated a technical support work order, marked it as an administrative task outside my current job scope, and sent it to Julian for authorization. Julian did not understand the regulatory importance of the system. He assumed it was just a routine database update and forwarded the request to Valerie Gomez, our operations VP. Valerie, assuming it was a human resources issue regarding my job duties, forwarded it to Diana Briggs. Diana sent the ticket back to me with a brief note, asking me to perform the routine database check as usual. I immediately replied that FDA compliance validation fell outside my designated maintenance duties. I explained that I would need written authorization from Julian and a union representative present to handle the request. Meanwhile, the new systems engineer, Liam Brooks, had started shadowing the department, but he had no idea how my custom code worked. Julian had assured everyone that Liam was a database genius, but Liam spent his first week staring blankly at the custom interfaces I had written in 2015. He did not know how to link the Yaskawa robotic sensors to the German machinery logs. Every time he tried to run a query, the system returned errors. The technicians on the floor were getting frustrated because they could not sign off on their batches. No one authorized my work order, and no one updated the records. On Friday, October 25th, at exactly 12:01 in the afternoon, the database reached its 35-day limit without validation. The system functioned exactly as I had programmed it. It instantly flagged the facility as non-compliant. Because of FDA regulations, the software automatically sent notifications of the compliance failure to the regulatory inspectors, our commercial insurance provider, and our primary medical customers. The fallout was immediate and catastrophic. By 2:30 in the afternoon, three of our largest healthcare customers were on the phone with Valerie, demanding to know if the medical devices we had shipped were compliant. By 4 o'clock, our insurance carrier sent an email stating they would suspend our liability coverage if we did not resolve the compliance status immediately. At 4:45 in the afternoon, we received an official notification from the government, scheduling a surprise inspection for the following Monday. The plant was now 72 hours away from a complete disaster. If we failed the inspection, we would lose the FDA certification, and getting it back was going to take at least 6 months, during which we would be legally barred from manufacturing 75% of our medical devices. We would be forced to breach contracts worth $18 million. Furthermore, shutting down that much production would mean that we had to lay off 180 workers. My union representative later told me that a sudden layoff of that scale would violate the Worker Adjustment and Retraining Notification Act, which is found in 29 of the United States Code, under Section 2101, and this requires 60 days of advance notice for mass layoffs, exposing the company to massive class action lawsuits. At 2:47 in the afternoon, I received a calendar invite for an emergency operational continuity meeting at 4 in the afternoon in the main conference room. The attendee list included Julian, Valerie, Diana, and two new names, Eleanor Vance, representing the family owners, and Preston Finch, the company's chief legal counsel. I went to my toolbox, pulled out the key person technical agreement from 2018, and put it in my pocket. Before the meeting, I went down to the break room to get a cup of coffee. Mateo Silva was there, staring at his phone with a stressed expression. He asked me what was happening, noting that half the lines were down, customers were screaming, and rumors were spreading about losing our certification. I took a slow sip of my coffee and told him that I was simply following Julian's instructions to stick to my job description. Mateo looked at me for a long moment, and then a slow grin spread across his face. He told me that I was a genius for doing exactly what they had asked. I checked my watch and told him the managers would probably figure that out in about 10 minutes. I walked up the stairs to face the board and see how they planned to handle the crisis. The conference room on the second floor was packed when I walked in at exactly 2 minutes before 4 in the afternoon. Julian was sitting near the head of the table, his face pale and his hands shaking slightly. Valerie Gomez was typing furiously on her laptop, while Diana Briggs stood near the window, looking out at the plant yard. At the center of the table sat Eleanor Vance, the matriarch of the family that owned the company. Next to her was Preston Finch, the chief legal counsel, who had his briefcase open on the table. The atmosphere was incredibly tense. Julian started the conversation, his voice strained and higher than usual. He said that we needed to address the operational failures. He listed the problems, stating that line 3 had been down for 8 days. The precision laser cutter had been offline for 3 days, and the FDA had scheduled an emergency audit. He accused me of refusing to help and claiming it was not my job. I sat down, set my coffee cup on the table, and said that was correct. I explained that Julian had instructed me to stick strictly to my job description. And I was doing exactly that. Valerie leaned forward, asking how I could let the plant fail when I had the skills to fix it. I explained that my old job description only covered basic maintenance. The complex database systems, predictive sensors, and vendor agreements were things I had created on my own initiative, outside my job scope. Preston Finch, the lawyer, opened his folder and asked if I was refusing to perform critical duties. I told him I was doing all my contract duties. I added that if they wanted to expand my responsibilities, we needed to discuss a new contract and fair compensation. I pulled the key person technical agreement from my pocket and slid it across the table to Eleanor Vance. She picked it up, her eyes scanning the signatures of Gerald Hodges and herself from 2018. She nodded slowly and passed it to Preston. Preston read it, his eyebrows rising. He looked at Eleanor and asked if she had signed this. Eleanor confirmed that she had, explaining that Gerald had brought it to the board to protect my custom work and prevent the company from losing its institutional knowledge if I ever left. Preston turned to Julian and Valerie. He explained that the agreement was fully enforceable. He stated that under the terms, I retained ownership of the custom code, predictive algorithms, and database interfaces. The company had a license to use them, but we could not modify them or transfer their administration to another employee like Liam Brooks without my written consent. He warned that if they tried to bypass this, they would violate federal copyright laws, specifically the exclusive rights of the owner under the Title 17 of the United States Code in Section 106. Valerie was shocked. She explained that the predictive system was running on 23 critical machines, and without it, the downtime costs were going to skyrocket. Then, Eleanor pointed out that losing the FDA certification would destroy the Oak Ridge contract, cost $18 million, and force us to lay off 180 people. She looked at me and asked what it would take to resolve the situation and secure the intellectual property for the company. I had my terms prepared. I told them I would transfer technical ownership of the systems for $650,000, paid in monthly installments over 18 months. In addition, I wanted my role reclassified to senior plant engineer, reporting directly to Valerie with a base salary of $115,000 and a 15% annual bonus target. Finally, I demanded final approval authority on any purchasing or equipment decisions that affected the systems I had built. Julian gasped, claiming that was too much money, but Eleanor cut him off, stating that it was fair market value considering the cost of rebuilding the systems from scratch and the millions we would lose in a shutdown. She looked at me and agreed to the terms, offering a consulting rate of $125 an hour for the weekend to get the machines running and fix the FDA database immediately before we signed the contract on Monday. I accepted. I spent the weekend recalibrating the Vanguard laser, resetting the Haas CNC machine, and validating the 27 compliance logs. By Monday morning, the red alerts were gone, and the FDA inspection went smoothly. On Monday, October 28th, at 9 in the morning, I signed my new contract in Diana's office. Eleanor had also added an extra clause granting me 8,000 stock options that vested immediately. Julian was quietly let go 2 weeks later, and Liam Brooks became my assistant, eager to learn how the systems actually worked. 18 months later, the Vance family sold Apex Medical Manufacturing to a larger corporation for $95 million. My stock options were worth $62,000. I finished receiving my $650,000 in April of 2026. I used a portion of it to buy a 12-acre farm outside Akron, where I now spend my weekends. Sometimes, the most effective way to deal with bad management is to give them exactly what they ask for and let the system show them the value of the work they took for granted.